We were down to 2 physicians for this area. That left us with 10,000 people in the region without a family physician.
We went 18 months without enough of those doctors to deliver babies in a community. That's tough on anybody in a community, especially an immigrant community, not understanding that.
It doesn't look like it is.
That was a very difficult time for us. We wondered if we'd even be able to keep our clinic running.
We've had a very beneficial relationship with RPAP. They were our initial resource in trying to get our staffing levels back.
David, how are you doing this morning?
Meet RPAP, the Alberta Rural Physician Action Plan. RPAP has 5 basic areas of emphasis that are reflected in the name of this independent, not-for-profit company funded by Alberta Health. Alberta and Albertans, rural and regional communities, practitioners who serve them, action for effective and efficient healthcare, and planning for future doctors, healthcare workers, and rural communities.
We have found that with the addition of new doctors, emergency room visits are decreased drastically, and they're being used for what they really should be used.
They've examined all of the issues around what may attract a doctor, what may keep a doctor. Not only is it important certainly to focus on bringing doctors here, but you need to ensure the ones that you do have are happy.
RPAP's mandate is to serve rural students, medical students and resident physicians, rural healthcare practitioners and their families, and Alberta Health Services and Alberta's rural regional communities. Go! Education is the foundation of RPAP's success. RPAP works with Alberta high school students and medical students to create awareness about careers in rural medicine. Through its educational initiatives, RPAP supports rural medical services, the recruitment and retention of physicians and healthcare practitioners for rural Alberta communities. Through rural clinical placements and community exposure, shadowing experiences, financial support and residency training through the Alberta Rural Family Medicine Network, RPAP assists learners pursuing careers in rural medicine.
Any exposure that we can get of bringing future physicians to the north, I think the greater success we'll have with physician recruitment.
RPAP connects the communities of rural high school students, medical students, and resident physicians with currently practicing rural physicians and healthcare practitioners, as well as with Alberta Health Services and Alberta's rural communities.
We got to do so much hands-on stuff this weekend that is going to put us at an advantage to other people in our class when it comes to being tested on some of this stuff. So very valuable in that sense too.
When you come and do practical hands-on skills, it just kind of remotivates you and reminds you of what you're going to end up doing, and definitely feel kind of rejuvenated and remotivated.
RPAP supports physicians currently practicing in rural Alberta with a number of initiatives including enhanced skills training programs, RPAP awards programs for rural Alberta physicians and communities, continuing professional development initiatives, and locum programs. APLjobs.ca is the go-to resource for physicians from other provinces or countries who are looking for family practice and specialist opportunities throughout Alberta. To benefit and support healthcare in rural communities, RPAP offers Alberta's rural and regional communities numerous programs to bolster their own community attraction and retention capacity.
RPAP has been very instrumental in helping us understand recruitment. It's up to us to sell our community. You know, don't just sit back and expect somebody else trying to bring doctors to your community. The communities are the best advocate for recruiting physicians.
We've got to keep connected with RPAP and like organizations in order to retain medical staffing that we do have.